Alright, so we're back now. Going to do the second half of this one real quick. So the chemical control methods for microbes. In this one, again, we're really going to be looking at different chemicals and how they can how they work. The main thing I would say on this one is it sterilization? Is it not? Is it a good disinfectant or is it a good antiseptic? So again, remember antiseptics, are disinfectants that you can use on living things. Again, obviously, there are certain things we really would like to have work well in this one. So these different chemicals be able to work at low concentration, not have toxicity, be stable in different types of solutions, can penetrate, affordable, don't stain or corrode things. Again, different levels here as well. There is going to be some certain high-level germicides that can kill and be sterilants completely. Again, intermediate level stuff, and then again, low level stuff, which is going to get a lot of vegetative cells, but might not get to spores and certain other viruses. Different things can influence this as well, and this is one, if you honestly looked at the disinfectants at your house here, you probably see that spray it on, and leave it on for a particular period of time. Don't just put it on there and not do anything and wipe it right off. So time of exposure, how much is contaminated, what's being treated exactly, and how does it work are all things that are going to influence how well these are going to work. These are our main categories. I will give you a few examples of each of these. And it's basically running through, is it a good disinfectant or is it a good antiseptic? Mechanism of action, kind of standard uses, what might we use it for? So the halogens, these are going to be... It kind of has to do with where they are in the periodic table, way over on that right side, right before the noble gases. You have a lot of different chlorine-based compounds. So your chlorine gas is actually one, but that's really toxic. Hypochlorites, which are probably the most common type of halogen you'll be experiencing. That's bleach. What these do is they are intermediate level ones. They mess with disulfide bonds between particular amino acids. One interesting thing about the chlorine compounds is they are inactivated in sunlight. That's why if you have a pool, you have to treat it with chlorine every so often. And this is actually pretty widely used in disinfection, especially with city water supplies. Very widely used with sewage treatment and water treatments. Again, good disinfectant, bleach water. If you've ever worked at a restaurant, bleach water is pretty widely used to clean off the tables. Iodine compounds are another one here. So they have these iodophores, which are kind of iodine alcohol mixes. Betadine being a good example of that. These ones, like nice intermediate level ones, probably some of our best antiseptics that we have. So I might use them in the mouth. They're, good disinfectants. Definitely not sterilizing, but probably one of the most widely used, as long as you don't have an allergy to it, type of antiseptic. Phenyl compounds, phenolytics, these are certain chemicals that what they really do is they mess with the cell walls and membrane. Not real high level ones. Honestly, one of the first disinfectants that was widely used. So when we talk about Semmelweis and Lister, they actually used phenyl water to clean off their instruments to wash their hands with. It is, at least used to be, one of the main components in Lysol. And that's part of the reason that they always perfumed it up so much, because phenol actually in and of itself not real great smelling. This kind of shows the different compounds, and again messes with the cell membrane, and that will really mess with the bacteria. Chlorhexidine, this is another antiseptic. I don't really have a thing to explain the chemical compounds of this, but if you're ever using a surge scrub, a lot of times this is the disinfectant that's going to be in it. Like it says there, surfactant, which helps pull stuff off the surface of whatever you're cleaning. It's a denaturant, kind of intermediate level, and again, pre-surge scrubs, skin cleaning off. So if you've ever kind of preemptively or prophylactically been given some type of surgical scrub to clean off with before you go in for surgery, it's generally chlorhexidine based. Alcohols, another kind of intermediate level antiseptic. Alcohols are pretty good at messing with membranes, and especially vegetative cells and fungus. And you have to use them at a decently high concentration, 50 to 95% alcohol solutions. That being said, most of your vodkas and stuff like that are pretty darn close to 50. So that's one, if you're ever out someplace and that's all you have, it's going to sting. really bad, but to clean a wound, it is better than not doing anything with it. Like I said, will sting. Hydrogen peroxide is one that we've probably all experienced as well, which you usually have at your house is a very weak solution. It's 3% H2O2, which is hydrogen peroxide. The really strong solutions can actually be used as sterilants. Toxic issues with these ones, definitely. These are really strong oxidizing compounds. Can at 25%, it will start taking skin off your fingers. 3% solution, it does damage your skin a little bit. At very low concentration, like we said, you can use it as an antiseptic. Not as widely used anymore. Antibiotic solutions are much more widely used now. I will say at high concentrations, though, it is a sterilant. So your different soaps, these are ones that really mechanically move stuff off. You have some of these quaternary compounds that can mess with permeability, so these are really low-level ones. But again, we already know washing our hands is one of the biggest things we can do to help to prevent infection. Other things that are helpful here, if you've ever heard of somebody taking colloidal silver, and a lot of these other heavy metals like gold, they are antibacterial in nature. I can show you this slide right here. See the zones of inhibition around this little piece of silver and around, it looks like a little gold squirrel shaped thing here. That is inhibiting the growth of those bacteria around that. These are usually not very widely used. Like it says here, mercury is another one as well. Mercury, though, we all know, quite toxic. So not real high level anyways, but most of these at any level are going to be toxic. Silver and gold a little bit less. A lot of the other heavy metals much more so. So again, not widely used. Here and there, every once in a while, they used to do the silver nitrate for the eyes on the infants. They now use antibiotic creams for that. Different aldehydes. Probably the most common one you've ever heard of is formaldehyde. If I asked you what is formaldehyde, you're probably going to turn around and say, oh, that's what they preserve specimen in. But when you really think about what preserving specimens is doing, what it is actually doing is it is stopping them from decaying. And we already know most of your decaying types of things are fungus and bacteria. So if you can stop something from decaying, it really means you're stopping bacteria and fungus from growing. There is certain aldehyde solutions that are sterilants for heat-sensitive instruments. Again, highly toxic. These are high-level compounds. They really link DNA and proteins together, really make it so nothing works. Formaldehyde is a really strong preservative. Again, high toxicity issues on these ones. These are definitely only disinfectants. That you would never want to use these as at least antiseptics at all, due to cancer concerns and things like that. There's a few things called ethylene oxide, propylene oxide, sterilizing gases, certain plastics, medical supplies. Not as highly used now as ionizing radiation, but they are out there. And this just shows you some of your more common products you may have worked with and what their active ingredient is. So you can see Lysol there. Has a quaternary one here. Tilex is pretty much bleach. See some of the other ones here. Scope and the hand sanitizer are both straight ethanol, which is alcohol. So you can kind of see some of these different ones, what their actual compounds are. And other than that, that is it. So I have these done for you now. I'm going to stop this recording.